Hi, it's Dr. Rajesh Khanna back at your service telling you more information about eye conditions. Today we are going to talk about something very common and a lot of confusion is there. Basically, we are talking about Chalazion, Stye, hordeolum internum or hordeolum externum. So forget all those big words and remember a lot of people get bumps on their eyes. So we're going to see why do we get it, how can we prevent it, what's the best treatment, and how can we prevent recurrence, and at any time should we be worried about them. So our lids are filled with glands. A lot of people think the lacrimal gland, which is in the upper outer part, is the only one which produces tears. There are 80 in the upper lid and 40 in the lower lid glands called meibomian glands, which produce secretions which add to the tear film. Any gland has a whole body where it's produced and a mouth or a neck where it comes out into the eye. If due to pollution, infection, makeup or dust, whatever the reason, these pores were to get blocked, just like a pimple forms. When the pore for the oil gland gets blocked, it swells up. Same way, when the pore gets blocked, there is swelling. This is non-infected and it's just swollen, but inflammation does set in. This is called a chalazion. So the best treatment for this would be to do lid wipes so we can open the pores, warm compresses so the secretions can melt, and that usually should be good enough in the beginning. So you do warm compress to melt down everything and open up the pores by scraping with special lid scrubs, not like baby shampoo and all that's old stuff. If it doesn't help, then we can add steroid antibiotic ointment because steroids decrease inflammation and early infection could be beaten. The same condition, if it gets infected, is called hordeolum internum if the swelling and infection is on the inside, but if the swelling and the infection is on the skin side, it's called hordeolum externum. In those cases, we have to augment by giving oral antibiotics like Keflex so that they can reach via the blood to the exact place. So these things take time, and the best thing is to give it time, sometimes 4 to 6 weeks. The reason we are not eager to jump in and lance them and take it out is for two reasons. One is every time we do incision on the lids, if we destroy the glands we mentioned, we predispose the eye to dryness. Second, if the surgery is not done correctly, there's going to be recurrence. Surgery becomes easier as time goes by and the contents liquefy. So the lid is pretty solid structure where the meibomian glands are located. That's called tarsus. So when there is infection, they can have different glands involved and they can swell up. So if you go early on, you have to break the loculi or the walls between these glands so you can drain out everything on the inside. And usually it's pretty good, not much bleeding, you back to work same day or next day. If you leave the remnants and they close up before, then you can get a recurrence. Recurrence is not good because any recurrent chalazion in the same spot, you have to begin to suspect malignancy or tumors. That's why it's very important you go to a surgeon who understands all this and can do the incision and curettage. Curettage is scooping out the wall of the infected meibomian gland so that it doesn't cause recurrence. Because if recurrence still occurs, then you have to send it for biopsy to make sure that we don't have a sebaceous cell carcinoma. And you learn with experience. I'm going to give you an example of an 18-year-old I did many decades ago. And we didn't suspect any cancer or anything in a young person having it first time, but we did send it for biopsy because we were in a university-based hospital. And to our surprise, it came back as sebaceous cell carcinoma. Treatment of that is beyond this today's talk, but just remember, don't touch your eyes unnecessarily because you can bring bugs, dust, etc. Wash your eyes frequently, at least morning and night while brushing your teeth. At the end, wash your eyes. That clears the allergens and dust which might have gone into your eyes and which potentially can clog. If you apply makeup, make sure you remove it all. If you have any questions, 1-800-411-Khanna. Khanna is spelled Khanna. Have a wonderful day.